In a trauma setting, early pelvic stabilization can be life-saving. Pelvic fractures, especially from high energy impacts, can lead to severe internal bleeding. Applying a pelvic binder, like the T-pod binder we have here, helps stabilize the pelvis, reduce hemorrhage, and improve patient outcomes. Indications: a pelvic binder should be applied in cases of suspected pelvic fractures due to blunt trauma, especially if the patient is hypotensive, has pelvic pain, or shows instability on exam. Remember, do not apply if there's an open fracture with external bleeding that requires direct pressure. What equipment will we need for this procedure? Well, you'll see here we have a T-pod binder. There are a lot of other proprietary brands out there. You can also use a bed sheet if you're in a jam. An assistant should help with placement. Let's go through what's actually in the package here. So if we open up the T-pod binder, you'll find a piece of fabric that wraps around the patient and a cincher that goes over top of that fabric. You should also have a pair of scissors with you, which we'll talk about later. Correct placement is key. First, you need to assess for pelvic stability. Compress the pelvis inward. One provider should be doing this. It shouldn't be done multiple times. If there's any instability, hold the pelvis in that position until the binder is placed. The binder should be centered over the greater trochanters, not the abdomen or iliac crests. It's really important. Don't go too high, don't go too low. You can slide the binder fabric underneath the patient's knees and shimmy it up to the greater trochanters. If there is excess fabric, you can cut it or fold it onto itself. Now, when you're securing the binder, you need to make sure there's 1 hand width of space between each section of fabric before tightening. This allows for even compression and avoids over-tightening. There are loops for the excess string to wrap and secure into, and then cinch it down with the Velcro. After application, reassess the patient's hemodynamics. That's a quick guide to the T-pod pelvic binder. In trauma, early stabilization can save lives, so practice this technique and use it when indicated.